High blood pressure, also known as hypertension. Hypertension is a silent killer, a significant contributor to the global burden of disease, leading to a high incidence of cardiovascular diseases, including heart attacks and strokes. It affects billions worldwide and is often linked to other risk factors like obesity, poor diet, and physical inactivity. The prevalence of hypertension has been increasing over the years, making it a critical public health challenge that requires ongoing prevention and management strategies. High blood pressure is a global health issue, affecting approximately 1.3 billion people worldwide. It is more prevalent in low and middle income countries due to increased risk factors in those regions. The condition accounts for a substantial proportion of heart disease and stroke-related deaths globally. Burden of disease. The burden of hypertension is significant, contributing to 7.5 million deaths annually, which is about 13% of all deaths globally. It is a major risk factor for cardiovascular diseases, accounting for a substantial proportion of the global health burden. High blood pressure is the leading cause of cardiovascular diseases and premature deaths worldwide. Owing to the widespread use of antihypertensive medications, global mean blood pressure has remained constant or has decreased slightly over the past 4 decades. By contrast, the prevalence of hypertension has increased, especially in low and middle income countries. High blood pressure is the leading modifiable risk factor for cardiovascular disease and premature death worldwide. The prevalence and absolute burden of hypertension is rising globally. Awareness, treatment, and control of hypertension are unacceptably low worldwide. Reductions in risk factors, including high sodium intake, low potassium intake, obesity, alcohol consumption, physical inactivity, and unhealthy diet, are recommended for the prevention and control of hypertension. Multifaceted implementation strategies for hypertension prevention and control are needed to address barriers at the patient, provider system, and community levels. Comprehensive assessments are needed to evaluate the economic impact of hypertension worldwide. Globally, 7.6 million premature deaths, that is 13.5% of the global total, and 92 million deaths, that is 6% of the global total, were attributed to high blood pressure. About 54% of stroke and 47 of ischemic heart disease worldwide were attributable to high blood pressure. Monitoring high blood pressure globally while understanding what is happening at a country level is important to identify tangible and customized solutions for local, national, and global health policies to address high blood pressure. As reported in The Lancet, the number of people with hypertension globally in 2019 was over 1 billion, and this number has doubled since 1990. In 2019, the prevalence of hypertension in adults aged 30 to 79 years was 32% in women and 34% in men. High blood pressure is a common condition that affects the body's arteries. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. Blood pressure is measured in millimeters of mercury. In general, hypertension is a blood pressure reading of 130 by 80 millimeters of mercury or higher. The American College of Cardiology and American Heart Association divide blood pressure into 4 general categories. Ideal blood pressure is categorized as normal. Normal blood pressure is lower than 120 by 80 mmHg. Elevated blood pressure. The top number ranges from 120 to 129 millimeter mercury, and the bottom number is below, not above, 80 mm mercury. Stage 1 hypertension. The top number ranges from 130 to 139 millimeter mercury, or bottom number is between 80 and 89 millimeter mercury. Stage 2 hypertension. The top number is 140 millimeter mercury or higher, or the bottom number is 90 mm mercury or higher. Blood pressure higher than 180 by 120 millimeter mercury is considered a hypertensive emergency or crisis. Seek emergency medical help for anyone with these blood pressure numbers. Untreated, high blood pressure increases the risk of the heart attack, stroke, and other serious health problems. It is important to have your blood pressure checked at least every 2 years starting at age 18. Some people need more frequent checks. Healthy lifestyle habits such as not smoking, exercising, and eating well can help prevent and treat high blood pressure. Symptoms. Most people with high blood pressure have no symptoms, even if blood pressure readings reach dangerously high levels. You can have high blood pressure for years without any symptoms. A few people with high blood pressure may have headaches, shortness of breath, nosebleeds. However, these symptoms are not specific. Blood pressure screening is an important part of general health care. Blood pressure is the measurement of the pressure or force of blood pushing against blood vessel walls. Your blood pressure reading has two numbers. The top number is the systolic blood pressure, which measures the pressure on your artery walls when your heart beats or contracts. The bottom number is the diastolic pressure. This measures the pressure on your artery walls between beats when your heart is relaxing. The World Health Organization estimates that globally over 1.3 billion people aged 30 to 79 have hypertension. About 2 in 3 of those individuals live in low and middle income countries. Primary and secondary high blood pressure can coexist. For example, a new secondary cause can make blood pressure that is already high get even higher. You might also hear about high blood pressure that comes and or goes in certain situations. These hypertension types are white coat hypertension. Your BP is normal at home but elevated in a healthcare setting, hospital or health center. Masked hypertension. Your blood pressure is normal in a healthcare setting but elevated at home. Sustained hypertension. Your blood pressure is elevated in healthcare settings and at home. Nocturnal hypertension. Your BP goes up when you sleep. What causes hypertension? Primary hypertension does not have a single clear cause. Usually many factors come together to cause it. Common causes include unhealthy eating patterns, including a diet high in sodium, lack of physical activity, high consumption of beverages containing alcohol. Secondary hypertension has at least one distinct cause that healthcare providers, doctors can identify. Common cause of secondary hypertension include certain medications including immunosuppressants, NSAIDs, and oral contraceptives, kidney disease, obstructive sleep apnea, primary aldosteronism, which is also known as Cohen's syndrome, recreational drug use, including amphetamines and cocaine, renal vascular diseases, which are conditions that affect blood flow in your kidneys, arteries, and veins. Renal artery stenosis is a common example. Tobacco use, including smoking, vaping, and using smokeless tobacco. Is high blood pressure genetic? Researchers believe genes play a role in high blood pressure. If one or more of your close biological family members have high blood pressure, you have an increased risk of developing it too. What are the risk factors for high blood pressure? Risk factors that make you more likely to have high blood pressure include having biological family members with high blood pressure, cardiovascular disease or diabetes, being over age 55, being black, having certain medical conditions including chronic kidney disease, metabolic syndrome, obstructive sleep apnea, or thyroid disease, having overweight or obesity, not getting enough exercise, eating foods high in sodium, smoking or using tobacco products, drinking too much. What are the complications of hypertension? High blood pressure may lead to serious health problems including coronary artery disease, stroke, heart attack, peripheral artery disease, kidney disease and kidney failure, complications during pregnancy, eye damage, vascular dementia. Blood pressure categories. In 2017, the American College of Cardiology and American Heart Association issued new blood pressure guidelines. Healthcare providers in the United States use these when diagnosing and treating high blood pressure. The guidelines divide blood pressure readings into 4 categories. Normal blood pressure less than 120 mmHg systolic BP and less than 80 mmHg diastolic, that is bottom number, BP. Elevated blood pressure means 120 to 129 millimeter mercury systolic and less than 80 millimeter mercury diastolic. Stage 1 hypertension, 130 to 139 millimeter mercury systolic, 80 to 89 diastolic. Stage 2 hypertension, 140 millimeter mercury or higher systolic, or 90 millimeter mercury or higher diastolic blood pressure. There are some proven ways to lower your blood pressure naturally. Number 1, keep a weight that is healthy for you. 2, eat a healthy diet. An example is the DASH diet. This is a way of eating that is full of fruits, vegetables, whole grains and low-fat dairy products. Number 3, cut down on salt. Ideally, limit your sodium intake to no more than 1500 milligrams per day. If this is too difficult at first, you can start by reducing your daily intake by at least 1000 milligrams. Get enough potassium. Try to consume 3500 to 5000 milligrams per day, ideally through the foods you eat rather than supplements. Some foods high in potassium include bananas, avocados, and potatoes with chicken. 4th, exercise. Ask your healthcare provider for tips to get started. In general, start slow and work your way up to 150 minutes of aerobic exercise per week. Limit alcohol. Complications. The excessive pressure on the artery walls caused by high blood pressure can damage blood vessels and body organs. The higher the blood pressure and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including heart attack or stroke, hardening and thickening of the arteries due to high blood pressure, or other factors can lead to a heart attack, stroke, or other complications. Aneurysm. Increased blood pressure can cause a blood vessel to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. Heart failure. When you have high blood pressure, the heart has to work harder to pump blood. The strain causes the walls of the heart's pumping chamber to thicken. This condition is called left ventricular hypertrophy. Eventually, the heart cannot pump enough blood to meet the body's needs, causing heart failure. Kidney problems. High blood pressure can cause the blood vessels in the kidneys to become narrow or weak. This can lead to kidney damage. Eye problems. Increased blood pressure can cause thickened, narrowed, or torn blood vessels in the eyes. This can result in vision loss. Metabolic syndrome. The syndrome is a group of disorders of the body's metabolism. It involves the irregular breakdown of sugar, also called glucose. The syndrome includes increased waist size, high triglycerides, decreased high-density lipoprotein, HDL or good cholesterol, high blood pressure and high blood sugar levels. These conditions make you more likely to develop diabetes, heart disease, and stroke. Changes with memory or understanding. Uncontrolled high blood pressure may affect the ability to think, remember, and learn. Dementia. Narrowed or blocked arteries can limit blood flow to the brain. This can cause a certain type of dementia called vascular dementia. A stroke that interrupts blood flow to the brain also can cause vascular dementia. Tests. If you are diagnosed with high blood pressure, your provider may recommend tests for check for a cause. Ambulatory monitoring. A longer blood pressure monitoring test may be done to check blood pressure at regular times over 6 or 24 hours. This is called ambulatory blood pressure monitoring. However, the devices used for the test aren't available in all medical centers. Lab tests. Blood and urine tests are done to check for conditions that can cause or worsen high blood pressure. For example, tests are done to check your cholesterol and blood sugar levels. You may also have lab tests to check your kidney, liver, and thyroid function. Electrocardiogram, ECG or EKG. This quick and painless test measures the heart's electrical activity. It can tell how fast or how slow the heart is beating. During an ECG, sensors called electrodes are attached to the chest and sometimes to the arms or legs. Wires connect the sensors to a machine which prints or displays results. Echocardiogram. This non-invasive exam uses sound waves to create detailed images of the beating heart. It shows how blood moves through the heart and heart valves. Taking blood pressure at home. Your doctor may ask you to regularly check your blood pressure at home. Home monitoring is a good way to keep track of your blood pressure. It helps your care provider know if your medicine is working or if your condition is getting worse. Home blood pressure monitors are available at local stores and pharmacies. For the most reliable blood pressure measurement, the American Heart Association recommends using a monitor with a cuff that goes around your upper arm when available. Devices that measure your blood pressure at your wrist or finger aren't recommended by the American Heart Association because they can provide less reliable results. Treatment. Changing your lifestyle can help control and manage high blood pressure. Your healthcare provider may recommend that you make lifestyle changes including eating a heart healthy diet with less salt, getting regular physical activity, maintaining a healthy weight or losing weight, limiting alcohol, not smoking, getting 7 to 9 hours of sleep daily. Sometimes lifestyle changes aren't enough to treat high blood pressure. If they do not help, your doctor may recommend medicines to lower your blood pressure. The type of medicine used to treat hypertension depends on your overall health and how high your blood pressure is. 2 or more blood pressure drugs often work better than one. It can take some time to find the medicine or combination of medicines that works best for you. When taking blood pressure medicine, it is important to know your goal blood pressure level. You should aim for a blood pressure treatment goal of less than 130 by 80 mmHg. If you are a healthy adult age 65 or older, you are a healthy adult younger than age 65 with a 10% or higher risk of developing cardiovascular disease in the next 10 years. You have chronic kidney disease, diabetes, or coronary artery disease. The ideal blood pressure goal can vary with age and health conditions, particularly if you are older than age 65. Medicines used to treat high blood pressure include diuretics, which is also known as water pill, angiotensin converting enzymes, ACE inhibitors, angiotensin 2 receptor blockers known as ARBs, calcium channel blockers. Other medicines sometimes used to treat high blood pressure are alpha blockers, beta blockers, aldosterone antagonists, renin inhibitors, vasodilators, central acting agents. Always take blood pressure medicines as prescribed. Never skip a dose or abruptly stop taking blood pressure medicines. Suddenly stopping certain ones, such as beta blockers, can cause a sharp increase in blood pressure called rebound hypertension. If you skip doses because of cost, side effects, or forgetfulness, talk to your doctor about solutions. Don't change your treatment without your doctor's guidance. Resistant hypertension. You may have resistant hypertension if you take at least 3 different blood pressure drugs, including a diuretic, but your blood pressure remains stubbornly high. You are taking 4 different medicines to control high blood pressure. Your doctor should check for a possible second cause of high blood pressure. Having resistant hypertension does not mean your blood pressure will never get lower. If you and your doctor can determine the cause, a more effective treatment plan can be created. Treating resistant hypertension may involve many steps, including changing blood pressure medicines to find the best combination and dosage, Reviewing all your medicines, including those brought without a prescription. Checking blood pressure at home to see if medical appointments cause high blood pressure. This is called white coat hypertension. Eating healthy, managing weight, and making other recommended lifestyle changes. Self-care. A commitment to a healthy lifestyle can help prevent and manage high blood pressure. Try these heart-healthy strategies. Eat healthy foods. Choose fruits, vegetables, whole grains, poultry, fish, and low-fat dairy foods. Get plenty of potassium from natural sources which can help lower blood pressure. Eat less saturated fat and trans fat. Number 2, use less salt. Number 3, limit alcohol. Number 4, don't smoke. Tobacco injures blood vessel walls and speeds up the process of hardening of the arteries. If you smoke, ask your doctor for strategies to help you quit. Maintain a healthy weight. If you are overweight or have obesity, losing weight can help control blood pressure and lower the risk of complications. Ask your doctor what weight is best for you. In general, blood pressure drops by about 1 millimeter mercury with every 2.2 pounds. That means 1 kilogram of weight lost. In people with high blood pressure, the drop in blood pressure may be even more significant per kilogram of weight loss. Get more exercise. Regular exercise keeps the body healthy. It can lower blood pressure, ease stress, manage weight, and reduce the risk of chronic health conditions. Aim to get at least 150 minutes a week of moderate aerobic activity or 75 minutes a week of vigorous aerobic activity, or a combination of the two. If you have high blood pressure, consistent, moderate to high intensity workouts can lower your top blood pressure reading by about 11 millimeters of mercury and then the bottom number by about 5 millimeter mercury. Practice good sleep habits. Poor sleep may increase the risk of heart disease and other chronic conditions. Adults should aim to get 7 to 9 hours of sleep daily. Kids often need more. Go to bed and wake at the same time every day, including on weekends. If you have trouble sleeping, talk to your doctor about strategies that might help. Manage stress. Find ways to help reduce emotional stress. Getting more exercise, but practicing mindfulness and connecting with others in support groups are some ways to reduce stress. Try slow, deep breathing. Practice taking deep, slow breaths to help relax. Some research shows that slow, paced breathing, that is 5 to 7 deep breaths per minute, combined with mindfulness techniques, can reduce blood pressure. There are devices available to promote slow, deep breathing. According to American Heart Association, device-guided breathing may be a reasonable non-drug option for lowering blood pressure. It may be a good option if you have anxiety with high blood pressure or cannot tolerate standard treatments. Alternative medicine. Diet and exercise are the best ways to lower blood pressure, but some supplements are promised as heart healthy. These supplements include fiber, such as blonde, psyllium, and wheat bran. Minerals such as magnesium, calcium, and potassium. Folic acid. Supplements are products that increase nitric oxide or widen blood vessels called vasodilators, such as coenzyme Q10, L-arginine, and garlic. Omega-3 fatty acids found in fatty fish, high-dose fish oil supplements, and flaxseed. Coping and support. High blood pressure isn't something that you can treat and then ignore. It is a condition that requires regular health checkups. Some things you can do to help manage the condition are: take medicine as directed by the doctor, schedule regular health checkups, choose healthy habits, eating healthy foods, lose excess weight, and get regular physical activity. Manage stress, ask for help. Recent guidelines for managing hypertension emphasize individualized treatment based on patient-specific factors. Key points include lifestyle modifications such as diet and exercise, and pharmacological interventions that may involve starting treatment with a single medication or a combination therapy, especially for patients with higher blood pressure levels. Regular monitoring and adjustments based on blood pressure readings are crucial. Prevention of hypertension, high blood pressure. Fortunately, there are things you can do to reduce your risk of developing high blood pressure. These include: follow a healthy eating plan, cut down on sodium, keep a healthy weight, keep active, reduce alcohol consumption. Prognosis, outlook. Since high blood pressure does not cause symptoms, you probably won't feel any different with a high blood pressure diagnosis. But it is important to follow your doctor's instructions to bring your blood pressure down so it does not cause complications later on. Once high blood pressure leads to complications, you may start to feel symptoms of conditions like coronary artery disease or peripheral artery disease. These include stable angina, shortness of breath, leg pain. How long does high blood pressure last? If you have primary high blood pressure, you will need to manage it for the rest of your life. If you have secondary high blood pressure, your blood pressure will most likely come down after you receive treatment for the medical problem that caused it. If a medication caused your high blood pressure, switching to a different medicine may lower your blood pressure. Living with blood pressure. Call your local emergency department number if you have sudden symptoms of a hypertensive crisis, which include shortness of breath, headache, chest pain, blurry vision, heart palpitations, anxiety, dizziness, nosebleed, or vomiting. Know your numbers that count. Blood pressure. Knowing and understanding key heart numbers, blood pressure, cholesterol, and heart rate, along with your family history, allow you and your healthcare team to determine your risk for developing heart and cardiovascular disease. Knowing your risk is critical to preventing heart disease and for taking steps to improve your overall heart health. Why blood pressure matters? High blood pressure can cause significant damage to your eyes, kidneys, brain, and blood vessels. Left untreated, it can lead to kidney failure or vision loss. High blood pressure also can affect your ability to think, remember, and learn. Know your numbers and act on them. People 40 and older or anyone younger with risk factors should have their blood pressure checked by a healthcare professional, that is doctor, once a year. Younger people without risk factors should be checked at least every 2 years. Blood pressure should be less than 120/80. If it is consistently above the recommended level, lifestyle changes, medication, or a combination of the two can usually bring it down to a healthy level. Unless you can turn back time, your risk of developing blood pressure is going up. That's because risk increases as you age. High blood pressure tends to run in families, so if one of your parents or a sibling has the condition, you are also more likely to have it. A non-drug approach to lower blood pressure, also called renal denervation. The technique targets nerves that supply the kidneys. In 2023, the FDA approved 2 renal denervation systems for treating high blood pressure that cannot be controlled with lifestyle changes and medication. Both systems work by disrupting some of the nerves surrounding the renal arteries, which supply blood to the kidneys. One system uses ultrasound energy to target the nerves, and the other uses radio frequency energy. A third system, still under review at FDA, uses alcohol. Hypertension represents a major modifiable risk factor for coronary artery disease, heart failure, stroke, chronic kidney disease, and dementia. The 2023 European Society of Hypertension and 2017 American College of Cardiology, American Heart Association hypertension guidelines both emphasize proper blood pressure measurement, cardiovascular risk assessment, optimal lifestyle interventions, and specific pharmacotherapy management. Both guidelines recommend a lower BP target, that is less than 130/80 mmHg for adults at high risk, to reduce the risk of cardiovascular events. Key differences include a lower diagnostic threshold by ACC and HA criteria, that is less than 130 by 80 mmHg, than by European Society of Hypertension criteria, that is less than 140 by 90 mmHg, and age-based treatment targets, that is from the European Society of Hypertension criteria. Hypertension mediated organ damage, HMOD. Hypertension mediated organ damage is defined as the structural or functional alteration of the arterial vasculature and or the organs it supplies that is caused by elevated blood pressure. And organs include the brain, the heart, the kidneys, central and peripheral arteries, and the eyes. While assessment of overall cardiovascular risk is important for the management of hypertension, additional detection of HMOD is unlikely to change the management of those patients already identified as high risk. That is, those with established cardiovascular disease, stroke, diabetes, chronic kidney disease, or familial hypercholesterolemia. However, it can provide important therapeutic guidance on management for hypertensive patients with low or moderate overall risk through reclassification due to presence of HMOD and preferential selection of drug treatment based on the specific impact on HMOD. Adherence to antihypertensive treatment. Adherence is defined as to the extent to which a person's behavior, such as taking a medication, following a diet, or executing lifestyle changes, corresponds with agreed recommendations from a doctor. Non-adherence to antihypertensive treatment affects 10 to 80% of hypertensive patients and is one of the key drivers of suboptimal blood pressure control. Poor adherence to antihypertensive treatment correlates with the magnitude of the blood pressure elevation and is an indicator of poor prognosis in hypertensive patients. The etiology of non-adherence to antihypertensive treatment is multifactorial and includes causes associated with healthcare system, pharmacological therapy, the disease, patients, and their socio-economic status. Hypertension in pregnancy. Hypertension in pregnancy is a condition affecting 5 to 10% of pregnancies worldwide. Maternal risks include placental abruption, stroke, multiple organ failure, including liver and kidney, disseminated vascular coagulation. Fetal risks include intrauterine growth retardation, preterm birth, intrauterine death. Hypertension in pregnancy includes the following conditions: pre-existing hypertension, starts before pregnancy or less than 20 weeks of gestation and lasts more than 6 weeks postpartum with proteinuria. Second, gestational hypertension starts more than 20 weeks of gestation and lasts less than 6 weeks postpartum. Third, pre-existing hypertension plus imposed gestational hypertension with proteinuria. Fourth, preeclampsia. Hypertension with proteinuria, that is greater than 300 milligram per 24 hours, or ACR more than 30 milligrams per millimole. Predisposing factors are pre-existing hypertension, hypertensive disease during previous pregnancy, diabetes, renal disease, first or multiple pregnancy, autoimmune disease. Risks are fetal growth restriction, preterm birth. Fifth, eclampsia. Hypertension in pregnancy with seizures, severe headaches, visual disturbance, abdominal pain, nausea and vomiting, low urinary output. Immediate treatment and delivery required. Sixth, HELLP, hemodialysis. HELLP means hemolysis, elevated liver enzymes, low platelets syndrome. HELP syndrome. Immediate treatment and delivery required. Hypertensive emergencies. A hypertensive emergency is the association of substantially elevated BP with acute HMOD. Target organs include the retina, that's eye, brain, heart, large arteries, and the kidneys. This situation requires rapid diagnostic workup and immediate BP reduction to avoid progressive organ failure. Intravenous therapy is usually required. The choice of antihypertensive treatment is predominantly determined by the type of organ damage. Summary. An estimated 1.3 billion adults aged 30 to 79 years worldwide have hypertension, most, that is 2/3, living in low and middle income countries. An estimated 46% of the adults with hypertension are unaware that they have the condition. Less than half of the adults, that is 42%, with hypertension are diagnosed and treated. Approximately 1 in 5 adults, that is 21%, with hypertension have it under control. Hypertension is a major cause of premature death worldwide. Lifestyle changes can help lower blood pressure. These include eating a healthy, low-salt diet, losing weight, being physically active, quitting smoking, quitting tobacco. For most people, the goal is to have a blood pressure less than 140/90. Lifestyle changes can help lower high blood pressure and can help anyone with hypertension. Many who make these changes will still need to take medicine. Patients with resistant hypertension are at higher risk of complications including cardiovascular disease, stroke, kidney failure, and death. It is important to identify common factors that contribute to resistant hypertension to mitigate their effects. Hypertensive patients who have resistant hypertension should undergo evaluation for secondary causes. Along with lifestyle modification, a stepwise approach to management using antihypertensive medications with differing mechanisms of action is critical to achieving blood pressure control. Patients may require more antihypertensive medications. Take-home message. Reducing hypertension prevents heart attack, stroke, and kidney damage, as well as other health problems. Your health is your responsibility.